My name is Lena Hall. I'm a family nurse practitioner student, and today I'm going to be doing the skin, hair, and nails examination. So first I'm going to examine the patient's skin. I'm going to assess for color, pallor, cyanosis, and jaundice. I'm going to be looking at the patient's mucous membrane first. So I'll be using my pen light, and there is no redness, no swelling, any cyanosis observed in the lips, or go ahead and close your mouth. In the lips or the mucous membranes were observed. No cyanosis in the fingers, even coloring distribution, and no discoloring in the toes, and there's no cyanosis in the toes or the legs or the lower extremities. Next, I'm going to assess the areas for hypo and hyperpigmentation. So I will be looking at the arms, the upper extremities, and there's no hyper or hypopigmentation in anterior or posteriorly, and in the legs there is no hyper or hypopigmentation in the lower extremities also. I also assessed the hard palate in the when you opened your mouth, and I did not observe any cyanosis, any discoloration in the hard palate also. Next, I'm going to be assessing the scalp, and I will be looking for distribution of this hair, quantity, any lesions. I will be parting the hair in many areas. The hair is evenly distributed. There's thickness, no lesions, no lumps or anything observed in the hair. Now I'm going to be looking at the nail beds. There is no discoloration to the nail beds. There is no clubbing of the fingers, no swelling, no swelling of the joints or anything. And looking at your toes, there's no swelling of the toes, no discoloration of the nail beds, or any sort of sign of fungus or anything else. I didn't notice that there's no lesions throughout the body that I can observe. I don't see any nevi. If there was, I would describe them with asymmetry, borders, color, diameter, and evolution. Next, I'm going to palpate the skin for the skin temperature. So with the backs of my hands, with my fingers, I'm going to press my hands on the skin, and there is even distribution of warmth, and it's warm to the touch, and there's no moisture felt. And I'm doing the posterior and anterior of the skin. And now I'll do the same on the lower extremities. There's no moisture. It's warm to the touch. And the same, I will felt anterior and posteriorly. Now I'm going to assess the turgor of the skin. So I will pinch the top of the hand. No tenting observed on either side. And then I'm going to palpate the scalp. Now let me know if you feel any pain. I don't feel any lumps or bumps or anything throughout the scalp. Do you feel any pain?
No.
Now I'm going to palpate the skin, the fingers. No wincing when I'm palpating. Any pain felt when I'm palpating? No. Any pain when I'm palpating this hand?
No.
Okay. Now I'm going to palpate your feet. No wincing observed. Any pain?
No.
Okay. I'm going to palpate the toenails, the toes, and the fingers. All right. That is it for the skin, hair, and nail examination.